This doctor just lost his medical license after admitting that he regularly used crystal meth while off duty from the hospital. I shared the details of this case yesterday and asked for your opinions. Now I want to share mine. So first I want to look at it from both sides. So the argument for revoking his license is that doctors and nurses are held to a higher standard of professionalism and trust. Regular illicit drug use can impair judgment, reliability, and confidence even when it's off duty. And patients are literally putting their lives in our hands. So if there's any chance that substance use can impair patient care, that risk is unacceptable. The argument against revoking the license is what doctors and nurses do on their own time shouldn't always define their professional ability. And it's important to remember that doctors and nurses are humans as well with their own vices. So if patients weren't harmed and performance was maintained, should private choices really end a career? On this point, rehabilitation and supervision might be more reasonable than permanent punishment. So here's my personal take. Honestly, my gut reaction was, that's wild. A physician who knows firsthand the dangers of using unregulated street drugs still choosing to use crystal meth on a regular basis, that makes me seriously question his judgment on a very basic level. And if I'm questioning his judgment that deeply, I personally wouldn't feel comfortable having him as the doctor for one of my loved ones. If it were up to me, I'd probably argue for suspension rather than permanent revocation with mandatory treatment, counseling, and a long period of supervision before he returns to practice. But what do you think? Let me know if you agree or disagree in the comments.